gloves. Okay. And I'm going to perform pericare on the patient. Again, instructing her to remain in the same position. I'm going to toss my dirty gloves, perform hand hygiene, don another set of new clean gloves, not sterile. Okay. Now I'm going to begin setting up my sterile field. So I'm going to open this away from me in order to maintain the sterile field, remembering that I have a 1-inch margin that I can use. Okay. I'm going to grab this sterile drape, raise it up, being mindful of that 1-inch border that I have. And I'm just going to lay this down in the area I need to be working in. Okay, using that 1-inch border to get it to the position that I need. There we go. Okay, now I'm going to remove these gloves, perform hand hygiene again, and now I'm going to don my sterile gloves. Okay. We have the same concept here for sterile. It is using that 1-inch border that I have. For sterile gloves, you want to glove your non-dominant hand first. Make sure you only touch that inside of the glove because your other hand is not sterile yet. If my gloves rolled like this, I would get a new pair. But for this video, I'm just going to continue. I reach inside the glove. And got it. Again, if my gloves rolled this way, I would just get new gloves. All right, I can take that and throw it away if I want. Next step is setting up my sterile field over closer to the patient. Okay. I'm also reminding the patient at this time that they need to make sure that they're not moving because the sterile field is now set up. So, since I've gathered all my supplies, that includes the Foley catheter kit, my sterile gloves, clean gloves, hand hygiene, all of that. I'm going to take this catheter and I'm going to place it in the lubricant. I'm also going to test it using this saline syringe. Okay, so I'm going to insert this and I'm going to just push it a little bit just to make sure that it inflates, which let me show you. It is inflated. So now I'm just going to let that kind of passively withdraw, but I'm going to leave that syringe inserted because I'm going to need it later. Okay. Now that I have all of that set up and I know everything's working well, I'm going to take these sterile swab sticks in order to perform perennial hygiene. Okay. So I'm going to use one hand and break my sterile field. I'm going to spread the labia, clean the area farthest away from me first, discard, then the area closest to me, discard, and then one straight down the middle. You want to make sure that you don't close the labia after this because then you would have to start the process over again. Okay, so now I'm going to make sure this is well lubricated. I'm going to instruct the patient to take a deep breath and bear down as if she's trying to void. And I'm going to insert this into the urethra. And I'm going to insert until I see urine return. Now, if the catheter were to slip or go into the vagina or something like that, you would have to restart your entire process because it's no longer sterile. So, once you see urine flow, you push it another 2 inches past. If the patient feels, excessive pain or pressure at any time, you want to kind of dial back on this. Now I'm going to inflate the balloon. You want to put the full 10 mils in there and make sure that you document that so that whenever they remove it later, they know the amount that should be coming out. Okay, so now that I've done that, I'm going to remove the syringe and discard it. I'm going to tug slightly just to make sure it's in proper position, which it is. Then I'm going to discard all of these supplies here.
Or you can go upstairs into the other room.
And I'm going to remove my gloves, perform hand hygiene, put a set of clean gloves on in order to help the patient reposition and to properly secure the catheter to the leg. So you want to attach it about here to the inner thigh so that there's enough give that you're not pulling on the catheter. And you want to hang the catheter down somewhere on the side of the bed where it is below the bladder so that it can drain properly. Once I've secured that, finish discarding all of this, help my patient into a comfortable position. Get her all covered back up again. Okay, I'm going to make